Welcome, healthcare professionals. I'm Paul Tracey, CEO of Innovative Technologies and author of the Healthcare Compliance Guidebooks Cyberstorm and Compliance Made Easy. Today, we'll examine the significant HIPAA regulatory framework modifications scheduled for implementation in 2025. These forthcoming changes present substantial compliance challenges while simultaneously creating potential security vulnerability exposure points throughout your protected health information ecosystem. As your strategic compliance and technology partner, we've developed this presentation to provide actionable intelligence on navigating these regulatory developments while maintaining operational integrity and patient data security. Let's examine three critical regulatory developments requiring immediate strategic response from your compliance teams. First, the finalized rule harmonizing 42 CFR Part 2 with HIPAA privacy standards specifically addresses substance use disorder documentation. While effective since April 2024, covered entities must achieve full implementation by February 2026, requiring systematic protocol adjustments across your documentation architecture. Second, the Reproductive Health Information Privacy provisions finalized in April 2024 demand retroactive compliance measures, as the December 2024 implementation deadline has now elapsed. This creates potential exposure for non-compliant organizations. Third, the proposed comprehensive restructuring of the HIPAA Security Rule, published January 2025, constitutes the most extensive modification to healthcare cybersecurity compliance requirements in over a decade, necessitating fundamental reassessment of your security posture and technical safeguards. The strategic realignment of 42 CFR Part 2 with HIPAA standards fundamentally transforms the protected health information governance model for substance use disorder documentation. This integration establishes a unified consent architecture that significantly impacts operational workflows throughout your organization. Critical implementation elements requiring procedural modification include: first, the introduction of a consolidated general consent mechanism for treatment, payment, and healthcare operations (TPO) activities, replacing the previously fragmented authorization structure. This streamlines patient engagement while imposing new documentation requirements on your intake processes. Second, the revised framework permits controlled redisclosure of substance use disorder information under standardized HIPAA protocols, eliminating previous segmentation requirements but necessitating staff retraining on appropriate information exchange parameters. Third, the rule establishes substance use disorder counseling notes as a distinct protected documentation category with specialized handling requirements analogous to psychotherapy notes under existing HIPAA provisions. This mandates the implementation of granular access controls within your electronic health record environment. These modifications require systematic review of your consent management infrastructure, documentation taxonomies, and disclosure tracking mechanisms to ensure compliance while maintaining clinical workflow efficiency. The Reproductive Health Information Privacy Rule constitutes a significant expansion of protected health information safeguards, specifically addressing sensitive reproductive documentation. With the implementation deadline of December 2024 now elapsed, your organization faces immediate compliance obligations requiring prompt remediation measures. This regulatory framework necessitates comprehensive procedural modifications across your information governance architecture. Key implementation requirements include development of specialized classification protocols to properly identify and tag reproductive health information within your clinical documentation systems, implementation of enhanced consent mechanisms that reflect the rule's heightened disclosure restrictions, reconfiguration of existing access controls to establish appropriate information barriers while maintaining clinical continuity, creation of audit mechanisms specifically monitoring reproductive health information access patterns. Critical to successful implementation is balancing these enhanced privacy protections against your parallel obligations under the information blocking provisions of the 21st Century Cures Act. This requires careful policy calibration to ensure legitimate privacy restrictions don't inadvertently trigger information blocking penalties. Given the retroactive compliance requirement, we strongly recommend initiating an immediate gap analysis comparing your current state against the rule's specific technical safeguards to identify and address critical vulnerabilities in your information protection framework. The proposed security rule overhaul represents the most consequential restructuring of healthcare cybersecurity requirements since the original rule's implementation. This fundamental transformation abandons the long-standing flexibility-oriented approach in favor of a prescriptive compliance framework with mandatory technical safeguards. This is not a routine regulatory update. It constitutes a complete reconceptualization of how healthcare organizations must approach information security. The rule transitions from the historical addressable implementation specification model to mandatory technical controls, effectively eliminating the risk analysis-based approach that has defined HIPAA security compliance for over 2 decades. This shift aligns healthcare security requirements with more stringent frameworks seen in defense and financial sectors. Specifically, covered entities must now implement multi-factor authentication across all systems containing PHI, eliminating password-only authentication throughout your environment, universal encryption requirements for data at rest and in transit, removing the previous ability to implement alternative protective measures, mandated vulnerability scanning at minimum quarterly intervals with documented remediation workflows for critical high vulnerabilities within 15 calendar days, annual penetration testing requirements conducted by qualified third parties with specific testing scope requirements targeting both external and internal network environments, formalized disaster recovery protocols with recovery point objectives, RPOs, not exceeding 24 hours for critical clinical systems, a standard many facilities currently cannot meet, demonstrable recovery capabilities through mandatory tabletop exercises and technical recovery testing. Industry impact analysis indicates implementation costs will be substantial, with disproportionate financial burden falling on smaller healthcare organizations with limited IT security resources. The average community hospital can expect implementation costs exceeding $300,000, with ongoing compliance maintenance requiring significant budgetary allocation. This regulatory pivot demands immediate reassessment of your cybersecurity governance framework and technology infrastructure to identify critical compliance gaps requiring strategic investment. These sweeping regulatory changes are occurring within an environment of significantly intensified enforcement activity. The Office for Civil Rights has formally reinstated its HIPAA audit program with targeted emphasis on security rule compliance verification across all covered entity categories. This enforcement resurgence fundamentally alters your organizational risk profile. OCR has explicitly prioritized technical safeguard implementation as a primary assessment focus, precisely the areas undergoing the most substantial regulatory revision. Their audit methodology now incorporates technical validation components rather than relying solely on documentation review, creating heightened scrutiny of actual security control effectiveness. What this basically means is the days of self-attestation for compliance are over. In the past, having policies stating what you should be doing was enough to deter most auditors. Now you will be required to have third-party validation that those policies are in fact enforced. Financial implications of non-compliance have escalated substantially. Recent enforcement actions demonstrate OCR's willingness to impose maximum tier penalties for willful neglect, with settlements routinely exceeding $1 million even for smaller covered entities. Of particular concern, OCR has established precedent for categorizing failure to implement basic security controls as willful neglect rather than mere negligence, triggering the higher penalty structure. Your organization's historical approach to HIPAA compliance, particularly if reliant on risk acceptance rather than remediation, now represents material financial exposure under this enhanced enforcement paradigm. We're seeing a clear regulatory shift toward viewing security implementation as a non-negotiable requirement rather than a risk-based decision. To effectively navigate this transformed regulatory landscape, your organization requires a structured, comprehensive approach to compliance preparation. We recommend implementing the following 4-phase action plan. Phase 1, conduct an enhanced security risk analysis, HIPAA Section 164, 308A12A, mandates annual security risk assessments, but the new rule significantly expands this requirement. Your assessment must now include documented evaluation of all systems containing ePHI against the new prescriptive standards, gap analysis specifically addressing multi-factor authentication implementation, vulnerability assessment aligned with the new 15-day remediation requirement, data classification mapping, identifying reproductive health information repositories. Phase 2, develop 42 CFR Part 2, implementation architecture. Create comprehensive consent management workflow, accommodating the new unified TPO authorization structure. Establish procedures for SUD counseling, note segregation, and specialized access controls. Design staff training modules addressing permitted redisclosure parameters under the harmonized framework. Phase 3, implement Reproductive Health Information Protection Framework. Document reproductive health information identification protocols. Establish enhanced privacy controls for RHI data elements. Develop specialized disclosure tracking mechanisms for RHI. Phase 4, evaluate technical safeguards against new prescriptive standards, conduct MFA coverage assessment across all ePHI containing systems. Document encryption standards for data at rest and in transit, and verify backup recovery capabilities against the new 24-hour RPO requirement. To facilitate your assessment process, we've developed a comprehensive HIPAA compliance assessment checklist. This free resource provides you with a checklist to start assessing your current HIPAA posture. It's available at no cost on our website, upstatetechsupport.com, under the Resources tab and Free Reports section. We've also included the direct link in this presentation's description. This checklist serves as a valuable starting point for identifying your organization's specific compliance gaps requiring remediation. The implications of failing to adapt to these regulatory changes extend far beyond simple compliance concerns, creating existential risk to your organization's operations and financial stability. Recent enforcement actions demonstrate the severe financial consequences of non-compliance. Advocate Aurora Health faced a $100,000 per day penalty structure for ongoing HIPAA violations related to website tracking technologies. Oklahoma State University Center for Health Sciences incurred a $875,000 settlement following inadequate encryption implementation. The Diabetes Endocrinology and Lipidology Center, a small specialty practice, paid $5,000 per affected patient, $100,000 total, for failure to implement basic security controls. The absence of the technical safeguards now mandated by the security rule directly correlates with successful cyber attacks. Ardent Health Services experienced a 3-week operational shutdown affecting 30 hospitals after ransomware actors exploited unimplemented MFA, causing patient diversions and procedure cancellations. Ascension Health suffered a Reseda ransomware infection, compromising 8.8 million patient records after failing to implement adequate vulnerability management practices. Sanford Health's networked medical devices were disabled for 10 days following a security incident that specifically targeted systems lacking proper encryption. Let's consider the comparative costs. Proactive implementation of required technical safeguards for a 100-bed hospital, approximately $300,000. The average ransomware recovery costs for the same size facility are $1.2 million, and then OCR penalties for willful negligence up to $1.9 million. So $300,000 or $3.1 million are the options. Implementation timelines extend when approached reactively. For instance, a proactive MFA deployment is typically 60-90 days, whereas an emergency MFA deployment during incident response in 14 days at 3-5x the implementation cost, and encryption implementation during normal operations 120 days, whereas an emergency data protection during breach remediation will be 45 days with significant operational disruption and increased cost. Let's have a look at a case study. A community hospital system. A 150-bed community hospital delayed security rule compliance measures, citing implementation costs. Following a ransomware attack targeting their unprotected systems and 12 days of EHR downtime with a 60% reduction in surgical procedures during recovery and $1.2 million in direct recovery costs and $3.8 million in lost revenue and a $2 million OCR settlement. This is just one of many examples that demonstrate how postponed compliance investments ultimately resulted in costs 25 times greater than the original implementation budget would have required. As I've guided numerous healthcare organizations through regulatory transitions over my career, I've observed a consistent pattern. Those who approach compliance proactively not only avoid penalties, but actually create operational advantages through improved security posture. That's right, being compliant can actually improve workflows, system reliability, and operational efficiency. At Innovative Technologies, my team and I have developed a specialized HIPAA compliance framework specifically engineered to address these new regulatory requirements while minimizing operational disruption. Our approach is fundamentally different because we understand the unique challenges facing healthcare providers in the region, from the local regulatory environment to the specific threats targeting our community's healthcare infrastructure. Our comprehensive service suite includes enhanced security risk analysis. Our proprietary assessment methodology incorporates both current requirements and proposed standards, ensuring your compliance roadmap remains effective regardless of regulatory evolution. After conducting hundreds of healthcare assessments, I've refined our process to identify vulnerabilities commonly overlooked by general IT providers. Compliance of any kind requires expert analysis, especially now that validation will be required. Part 2 and RHI compliance architecture. We develop tailored policy frameworks and implementation plans addressing the specific workflow requirements of substance use disorder and reproductive health information protection, leveraging my experience implementing these protections at several regional health systems. Technical security implementation. Our expert engineers deploy MFA, encryption, and network segmentation solutions specifically designed for healthcare environments. Vulnerability management program. We provide continuous scanning, remediation support, and penetration testing services that align perfectly with the new security rule requirements. The same program that identified and remediated 137 critical vulnerabilities at a local medical group before they could be exploited. Business associate management. Our comprehensive BA verification program has identified non-compliant vendors at 84% of our healthcare clients, preventing potential compliance gaps. Documentation and audit preparation. My team creates and maintains the specific documentation OCR auditors request, structured for immediate production during investigations. Staff training and security awareness. Our healthcare-specific training programs address both compliance requirements and security awareness, with measurable improvement in security behaviors. I developed our compliance as a service model after witnessing too many organizations struggle with point-in-time assessments that left them vulnerable as regulations evolved. Instead, we provide ongoing support that adapts to regulatory changes and emerging threats, ensuring continuous compliance rather than periodic fire drills. As someone who's personally helped healthcare organizations recover from devastating cyber attacks, I can tell you with certainty, proactive compliance is always the more cost-effective approach. As we've examined today, these regulatory changes represent both significant compliance obligations and genuine security imperatives. Organizations that delay implementation face escalating risks with each passing week. I've guided dozens of healthcare organizations through similar regulatory transitions, and the consistent differentiator between successful and struggling implementations is simple: it's timing. Early adopters navigate these changes with minimal disruption while achieving sustainable compliance. Those who delay inevitably face compressed implementation timelines, higher costs, and increased operational impact. Here's your 3-step path forward. Contact our compliance team. Take the first critical step today by reaching out for an initial consultation. During this confidential discussion, we'll assess your specific situation and provide preliminary guidance on immediate priorities. Complete your comprehensive assessment. Our specialized healthcare security assessment will identify your specific compliance gaps against both current and emerging requirements, providing a clear roadmap for remediation prioritized by risk level. Implement strategic solutions. Our experienced implementation team will deploy the necessary technical, procedural, and policy solutions tailored to your organization's unique operational needs and budget constraints. I personally invite you to initiate this process today. The compliance deadline clock is already running, and security vulnerabilities don't pause while we prepare. Contact my team at Innovative Technologies. Visit upstatetechsupport.com, call 518-900-7004. Email info@upstatetechsupport.com. I sincerely thank you for your time and attention today. Your commitment to understanding these regulatory challenges demonstrates the dedication to excellence that characterizes healthcare professionals in our community. It would be our privilege to partner with your organization on this compliance journey. We're genuinely excited about the opportunity to help you transform these regulatory challenges into operational advantages that enhance both security and patient care. Thank you again, and have a fantastic day.